Hello, and thank you for joining our webinar today, Understanding Shoulder Dysfunction. Over the next 2 hours or so, we're going to get pretty deep into shoulder, what dysfunction is, what function is, and give you some real hands-on application that you can apply with your clients or possibly even yourself right away. So before we get started, just wanted to introduce myself so you know who you're going to be listening to over this webinar. My name is Mike Diebler. If you've attended an Exercise Etc. workshop, you've probably heard me speak at some point. I'm the Director of Education. I've been with the company since around 2008. My background in fitness, I was an All-American athlete in college. I went to the University of Connecticut. That's kind of where I first got started in the fitness world. I also got my degree in kinesiology, and then I ended up going to University of Florida to get my master's degree in exercise and sports science. That's where I first started working in the fitness industry as a personal trainer, got certified through ACE. I went through the NASM program, and then eventually I got my certified strength and conditioning specialist through the NSCA, and then I continued to receive different specializations and certifications as I've grown in the industry. So I currently live in San Diego. I've been out here for a little over 10 years, and for about 7.5 of those years, I'm the owner and operator of a private personal training studio out here in Carlsbad, California, actually. And just a little bit about our business quickly so you know what my experience is and how I'm going to teach this workshop. I see a wide range of client. I am still training. I'm in the trenches. So I like the education and being an educator, but I'll never want to give up training and actually working hands-on with clients to help them reach their fitness goals. I work with a variety of clientele from youth to older population and everything in between. I've worked with lots of youth athletes just trying to get baseline agility, coordination, and body awareness, and then all the way up into clients into their 90s, just working on functional mobility and strength to stay as independent as they possibly can. Majority of our population is general population, interested in losing weight and being healthier. Like I'm sure probably many of you are along the same lines there. The nice thing with our studio, I'm not alone. I work with a team of trainers that all specialize in different areas, so I get exposed to different styles of training, different philosophies, which is really great. It just makes me question things, what I'm doing, expand my horizon, and really always look for the best way to do things. We actually have a few therapists that work with us as well, so it's great to get that experience as well so we can work directly with a therapist when injuries and dysfunctions do come up so we know the best course of action to take. And really our number one goal is to make sure we're helping people and not hurting them. And I know that sounds like a silly thing, but sometimes when you just don't know all the information and you just start taking somebody through a workout, you might actually be making things worse. So that's kind of the idea behind this topic that we're going to be doing today with the shoulder, because so many people have shoulder dysfunction and they may know it or they may not know it, and they start an exercise program and they end up hurting themselves because they didn't know the right course of action. So that's my intention of this workshop, is to use my experience that I've gone through and the information that I've gained over the years and help you improve your training, get your clients moving the best that they can and giving the results that they hire you for. Just real quickly before we get started, you are on this webinar most likely to get CECs along with the information. So just here's the steps on how you're going to get your certificates. First, make sure you watch through or listen on this whole webinar, complete it. Make sure your printer's on. You're going to log on to our website at exerciseetc.com. Click on the administration tab and then click on the webinar on demand certificates. You're going to have some information that you're going to fill out, and then you're going to see your certificate appear on there where you can print it out and save it for your records, or actually just save it on your computer if you prefer to save paper and do it that way as well. I'm sure I don't really need to mention this, but just do remember that our WebEx program that we use in order to view this webinar does record when you log on and off. So make sure you're not just fast forwarding and you are listening to all the information, take great notes. We're going to throw a lot of information at you, and the more notes the better, so you can take it all in and start applying it. So just make sure you review everything so you don't have the potential of getting denied your CCs for not viewing the entire workshop. Okay, our first slide here, just a reminder, if you come in and they have a known shoulder dysfunction, make sure you kind of cover your own liabilities and you are getting some type of release form to make sure that they are cleared for regular physical activity. They sign your waiver, they understand the risk of that activity. It's such a simple thing to do just to protect yourself, so make sure you're taking care of that. But oftentimes we don't know that there is a shoulder dysfunction, so it's just a good idea to make sure people, before they start working with you, that they do just get everything checked out to make sure that they are completely cleared for exercise. So our first slide here, trying to define what we're talking about. So what is a healthy shoulder? Is it having pain-free movement? Is it having optimal range of motion? Is it being functional based on their personal needs? Or is there such a thing as a healthy shoulder? Most likely, if you've been training for a little while, you probably don't get many clients that come in that don't have any issues at all. There's probably some type of pain or dysfunction that's occurred at some point. So it's rare that we get somebody that is completely ready to go, especially at the shoulder, because there's so many different things that can go on with this. So really, I know it sounds difficult, or sounds funny, but it is difficult to really define what a healthy shoulder is, because it could mean so many different things. But one thing I always like to bring up, there's just certain things that we want to make sure we're looking at when we're working with a client, especially in the beginning, that we have some type of assessment tool in place that we can determine where are they currently at and where do we need to get them. And some of the things that we're going to work on, or that we want to evaluate and look at as we start training somebody, is having that range of motion. Do they have complete range of motion of that shoulder joint? Do they have adequate strength levels, adequate stability, their endurance, their stabilization, their proprioception, their neuromuscular control? So there's all these different things that we're going to have to consider when we first start working with somebody, to make sure that they do have a healthier or a functional shoulder, because what we're seeing is that most people just don't. So I just want to stress the importance of using some type of an assessment, right? So assessing range of motion, assessing strength, assessing stability, and we'll go over some potential things that you might be able to do, or if you currently have some that you like, just continue to make sure that you're using them. But don't forget about written or verbal assessments as well, and really just make sure you're asking the right questions. Have they ever had surgery? Have they ever had an injury before? Any minor thing that maybe they haven't thought of, just really prying and find out what has their current lifestyle been and what has their previous lifestyle been. Maybe they played a sport in high school and college. They were a baseball player or volleyball player. That repetitive overhead movement is going to have its effects on the shoulder, and they're most likely going to have compensated because they had a tear way back, maybe they didn't know about it, or scar tissue has developed, or arthritis, or something's going on there, which has just led them to some type of dysfunctional movement. So just make sure you're asking about their previous history. Are there any movements that aggravate their pain, or are there any positions that cause discomfort, right? Just finding out as much information as you can about their shoulder. Here we have a few studies that they're just interesting statistics, and these are not the only ones out there, and there are other. These are just two examples of why shoulder function can be hard to see, because we often rely on pain as an indicator of dysfunction when that's really not what we want to do. So like in this first study that Shear et al., what they did is they took almost 100 asymptomatic subjects. So these were people that had no shoulder pain, and they looked at their rotator cuffs, and they found that 34% of them actually had some type of rotator cuff tear in their shoulder, even though they had no pain. So you might have a client come in and they say they're in no pain, everything's good to go, but if I don't really assess and evaluate how their shoulder moves, and I just start having them do bench press and overhead press, I might make that tear worse and worse, and now they do feel it. And now it's a complete tear, or now there's more inflammation or something along those lines. And actually in that same study, over 50% of those that were over 60 years old did have a rotator cuff tear as well. As you get older, it is more likely that you are going to have a rotator cuff tear. But that doesn't mean that if you're younger, you're off free. And actually that second study there looked at that. They actually looked at 30, so not a huge sample size, but 30 asymptomatic patients who are under 50 years old. And when they looked at their shoulder, they actually found no completely normal rotator cuffs. All right, so there was some type of dysfunction or tear, even in a younger population as well. So the main thing here is, or main things I should say is, one, pain and dysfunction are not the same thing, and two, don't wait for pain. Right? I don't want to be reactive, I want to be proactive. And I mentioned before, I work with therapists, but I am not a therapist myself. I'm a fitness professional. I'm just trying to help people move and feel better, but when pain comes up, that's a problem, and it's not really in my control anymore. So I want to be proactive and make sure that we don't lead to pain. So the things that the exercises I select for my clients are not going to increase dysfunction, or they're not going to increase pain. All right, so we just want to remember that difference there. There can be dysfunction, but no pain. Right? And that's a lot of what we're going to talk about as fitness professionals. When we start to see dysfunction and there's no pain, I'm going to try and work to improve the functional capacity of the shoulder joint. All right, and here we just have a few common shoulder conditions. We'll touch on each of them at least a little bit. We're probably going to spend the most time on the first two because, one, they're so closely related, and impingement and rotator cuff tears are just often common injuries and dysfunctions that we see with a client who's increasing their fitness program. But we also might see some labrum tears or dislocations or AC joint separations as well. So really there's a lot of different things that can occur within the scope of this workshop. We're not going to be able to cover them all in great detail. And again, we don't want to look at these in terms of, hey, I want to diagnose what's going on, because I'm not a medical professional. I just want to make sure I'm sticking with things that aren't going to increase the chances of these different conditions from happening. Or if I have somebody that comes in and they already have this condition or they previously have had it, I have a plan that I can work with them and make sure we don't relapse and have issues down the road. Okay, so we'll start with impingement. And just in case you're not familiar with what impingement is, it's basically we have the head of the humerus, which inserts into the glenoid, and this is the glenohumeral joint. So this is what most people think of when they talk about the shoulder, even though there are multiple joints of the shoulder. This is kind of the most common one that people go to because there's a lot of movement that occurs at this joint, and that's usually where the pain is felt, even though that might not be where the problem is. That they at least feel the symptom of pain at this location. So we have the rotator cuff muscles surrounding that joint, and we're going to talk more about the rotator cuff muscles, but their job is to hold that joint into place. And oftentimes when those muscles are not doing their job, we start to see that head of the humerus start moving out of position. It doesn't stay in its optimal alignment. So it actually starts pushing up into the subacromion space, right? And the acromion is the very top of the scapula, which we actually see some pictures of right here, that acromion, so the very top portion there. So when that shoulder is not stable, we start to see that humerus, the head of the humerus, push up into the underside of the acromion, and it's actually pinching on things. So it could be pinching on some of the rotator cuff muscles, the bicep tendon. There's a subacromial bursa, that it might be pushing on, right? So it is just a very general term, impingement. There can be a lot of different things going on there, but just a quick summary, that's essentially what's going on. So we have all that tissue being compressed, and they're probably going to feel pain every time that they lift their arm, and there might be some tearing or there might be some inflammation making it harder to do those movements there. So we're going to talk about the scapula, but we have this interaction of the scapula and the scapulothoracic joint and the glenohumeral joint, and they need to work together, and oftentimes they don't, and it leads to this impingement syndrome. But first, there might be a primary cause, and our primary causes are more anatomical or bony abnormalities or arthritic changes, maybe bone spurs, things like that. So we see our different types of acromion processes here, right? So we see our type 1, where we have a very flat acromion process. Our type 2, now we're getting, it looks kind of curved, and then our type 3, it's kind of hooked. So we can see a sharp piece actually sticking out. Oh, yellow might not be the best color. Let me change that, sorry. All right, so we have this sharp piece sticking out right here. And then in this space right here, we have different tissues like tendons and muscles going through. So as the head of the humerus pushes up, sorry, I'm not the best artist here, that pushes up, and we actually have rubbing on this little bony piece sticking out, and it actually can cut. And actually this type 3 that we see here, that is the highest correlation to complete rotator cuff tears. Type 2, that curve like we see here, that's also highly correlated with partial tears of the rotator cuff, right? And we can see this subacromion space right here, like in our type 1. So see we have a little bit bigger opening, but here and here that space is getting smaller and smaller, so that tissue just does not have as much room to go through. All right, so I just kind of want to bring those up, that could be reasons, and there's really not a whole lot that you're going to be able to do because those are anatomical changes. They might have to go in and actually shave off the end of that bone to make it flat again. So you wouldn't know this unless they previously came in and told you that this was a condition. So that's our primary causes. We also have our secondary causes, right? So there might be muscle imbalances. Right? With muscle imbalances, the two biggest that you're going to see with impingement, you're going to see an imbalance between upper trap and lower trap. We're going to talk a lot about muscles that surround the scapula. But that's one big one where upper trap is over-dominant and lower trap is not activating and doing its role as for stability. But we also see a big imbalance between our internal and external rotators of the shoulder. So typically our internal rotators are very tight or dominant, and then our external rotators are going to be significantly weaker compared to that. All right, so if I am trying to avoid impingement, those are just some areas that we can start working on, trying to improve lower trap activation, trying to improve external rotation of the shoulder. And that right there is actually a great start. Another huge reason somebody's going to develop impingement is going to be from a scapular dysfunction. And this, again, is kind of a broad term, but it's basically saying that for some reason the scapula is not stabilizing the glenohumeral joint the way that it's supposed to. And this is tricky to train because there's so many muscles. There's about 17 muscles that will attach to the scapula and control its movement and stability. And all of those muscles must be coordinated and work together in order to move the scapula in order to stabilize the glenohumeral joint. So we have this kind of chain effect, and the scapula often gets overlooked as an area to train with the shoulder, but we really can't separate these two. We have to improve scapular stability. So we'll talk about that a lot throughout this webinar as well. And then obviously poor exercise technique, just doing things the wrong way. We're going to talk about some exercises that probably you just want to avoid or at least modify if there's any chance of increasing the risk for impingement. and also overuse overhead. So if they play a sport, overhead sport like baseball, tennis, volleyball, things where their arm is constantly going overhead, be careful. Be careful how much you train overhead movement in the gym. If I know they're going to be doing a lot of repetitive movement overhead on their own, either from their work or their sport or activity that they do, I don't want to do a ton of that in the gym because I'm just doing more repetitions of that movement, which is going to beat up that joint over time. So I have to really monitor how much overhead training I do with that person. And there's lots of other exercises we can do besides overhead. So we'll talk about all those different reasons there. All right, and actually here is a much better picture. So if what I was saying didn't make sense, now we have a nice picture of impingement. So you can see the compression of either the rotator cuff tendon, like usually supraspinatus is going to be the biggest rotator cuff muscle that's affected here. Or it could also be the subacromial bursa. Oftentimes that's going to be impinged and cause inflammation or bursitis, something like that. So what we want to do is make sure the rotator cuff muscles are working properly to stabilize that joint, right? So again, here's the head of the humerus. As it sits right in that glenoid, right, in the scapula right there, we need these rotator cuff muscles, and we see a couple of them here, holding that joint in place. So when you move the arm overhead, so a lot of times, I'm going to pick a different color. Black is hard to see. Let's try red. Okay, so these big muscles like the deltoids, right, they're attached here. They're pulling the arm up, which is actually driving the humerus up. And what I want is these muscles, the stability muscles surrounding that joint, to actually pull back down and hold it in place. So these are tiny muscles that have to fight against the pull and the force of these really big muscles up here. All right, so we want to make sure we properly train the rotator cuff muscles to prevent that kind of movement, right? We need to improve stability at that joint there. All right, so we could spend a whole class on different assessments of the shoulder, but we're going to just keep it really simple here. Now, one, I do think you should assess range of motion and making sure they have pain-free movement of the shoulder. But if nothing else, at least clear impingement. And when we say clear, we're just doing a simple exercise to just find out if there's pain. And if there's pain when they do this movement, there's a really good chance that it's from impingement. We would want to refer to a medical professional for further evaluation and find out what exactly is going on here, what's being impinged on, what's the next course of action. Is there a rotator cuff tear and they need surgery, or no, they can do physical therapy and get better that way. You know, again, that's not going to be our decision to make. We're just going to look for red flags, right? Just like you would do an assessment and look at their health history and find out if they're high risk for heart disease, right? We just want to clear and say, you know what, based on the information that you had given me, you seem relatively fit and ready for exercise. Or I see a bunch of red flags. I think the next best action is for you to go see a medical professional and just have a further evaluation, look at your blood pressure, cholesterol, you know, whatever other actions they need to take, and see, are you ready for exercise? Or maybe there's a bigger problem and you need to do something else about it. But again, it's not our decision to figure out what course of action to take. We're just going to clear it and see where are the red flags. All right, so this is a simple test you can do, right? So you're going to take your arm, put it on, or I'm sorry, take your hand. So here, take your right hand, put it on the opposite shoulder. So you'll put it on your left shoulder, almost like you're hugging yourself. And then all you're going to do is lift your elbow up as high as you can, right? And as you lift it up, or as your client lifts it up, you just simply ask them, do you feel pain? And if they say yes, that's our sign. All right, there's impingement. I need to refer so that we can find out what the next course of action would be. Or what we're hoping, they say no, there's no pain at all, then we can proceed and we'll do our other evaluations or whatever else we have planned for that person. Do make sure that they understand like what's pain, what's tightness, what's discomfort. because sometimes, and this is just my own personal experience, I'll have them do this exercise and they might say there's pain, but when we further evaluate what's going on, they'll actually say, well, no, it's not pain, I just feel tight. It's really hard to lift my arm up. And that's a different story. If it's hard to lift your arm up, maybe there's just something restricting your movement and you have really tight muscles surrounding that shoulder, and we're going to work on your mobility and take that route, but we don't actually have to get medical clearance in that case. So just make sure they understand what pain actually is. But again, really simple exercise you can do to just at least eliminate that impingement there, or eliminate that they have impingement. All right, I've already started mentioning the scapula. It's not a bad idea to do a quick assessment of the scapula as well, and honestly, there's a ton of different things that you can look at, but again, I'll try and keep it simple, just a few key things when you look at somebody's scapula. So, one, you may not be able to get their shirt off like we see in this picture. If they can have a tighter shirt or sports bra or tank top, that's ideal. If not, we do the best we can, and we might have to use our hands a little bit to just see. So the first thing you're going to look for is winging, and that's actually what we see in this picture here. So we can see the right scapula is actually winging much more significantly than the left, but they do have a little bit of winging on each side. And typically you'll hear 3 grades of winging, or you might hear scapular dyskinesis. Grade 1 or stage 1 is basically going to be that medial border, that bottom right here. You're just going to see that to start to stick out from the rib cage. So you just see this little bony presence sticking out from the back. Grade 2, now you're actually going to see a little bit more of that medial border on the inside start to come up, and then stage 3, like we see here, you're going to see that whole scapula basically coming off. So it gets to the point where you could probably, like in this example, if you took your hand, you'd be able to slide your fingers underneath their scapula, right? So there's a huge gap there. That's very significant, and there's going to be, I mean, we know right now that they cannot move their shoulder properly, and they are going to have a dysfunctional shoulder. Again, it doesn't matter if there's pain or not. If that scapula is in its resting position like that, we know we're going to have a problem, because remember, the scapula and the glenohumeral joint have to work together to reduce things like impingement or other problems. So check for that winging there, and we'll talk about some things to address winging and really improving scapular stability in general. So look standing like you see here, looking seated, look in different postures really. Look in a tall plank or just hands up against the wall like they were going to do a push-up on the wall, because all we're doing is having them move their shoulder and seeing if it creates winging. So a lot of times you'll see somebody and you don't see any winging when they are just standing there. But as they do push-ups, all of a sudden you see the scapula sticking through their shirt. Right, so we know as soon as we add resistance or stress that joint, they compensate by reducing stability at their scapula, and we see that wing posture there. So don't just rely on one position. Make sure you're checking it and watching it during exercise. One that I really like to do is have them do internal rotation, kind of like a scratch test. Right, so if you were going to reach your right hand behind your back, like you were just trying to scratch the middle of your back, right, have somebody do that, and one, you're just looking at some internal rotation range of motion, but if you really watch their scapula or put your hand right on the scapula, you'll start to see most people actually go into a wing posture when they do that. So they look great when they're just standing there, but they internally rotate and extend the arm, and all of a sudden they can't stabilize that scapula, and it pops right off of their rib cage. So these are just things we're going to have to work on. There's probably some tightness in that shoulder. There's definitely some weakness in those muscles that attach to the scapula. So we'll have to work on improving that. All right, and then also, again, just assessing some other things you can look at. The distance of the medial border, so that inside border, we want to see really no more than 3 inches or so from the spine. All right, so right here, that distance, no more than 3 inches. And then one more thing, again, this might be hard to see in some people, but I drew these parallel lines here. we do want to see parallel lines there. That's going to be that nice neutral position of the scapula when the arms are down like that. But oftentimes you see people that just at rest, their shoulders are rotated or their scapulas are rotated. So some people you're going to see, and I'm exaggerating it a little bit, but those borders are going in like that. This is typically what's happening when you raise your arms up. They're going into, or I'm sorry, they're going into downward rotation, which would occur when we drop the arms down. All right, so they're stuck in downward rotation, so there's too much movement there of the scapula. And then you have the opposite, what I started to say, when people raise their arms up, then they go into that upward rotation, there, and the medial border of the scapula are pointed that way. So again, just a quick look just to see what's the resting position of the scapula, and then we can develop a plan from there. Okay, remember our whole goal is to be proactive, so we want to talk about things we can do to help prevent impingement, right? Once impingement occurs, they probably want to go to therapy and find out what the next course of action is, because there's pain most likely with movement. So we're doing our best to avoid pain in any case. So number one, we want to improve that scapula stability. All right, so, and when we say scapula stability, sometimes this confuses people. That doesn't mean the scapula should be fixed in place. So a lot of times we make the mistake, we'll always cue that retraction or back and down posture. You know, sometimes that is appropriate, but in order for my scapula to be stable, they have to move, right? So I need to be able to watch that scapula move as they lift their arm up overhead, like I was saying. When the arms go up overhead, the scapula should go into upward rotation without winging. As the arms come down, they should go into downward rotation without winging. Right? That is a stable shoulder, right? It has to move in order to provide stability for this, the glenohumeral joint. Right? I know this might sound weird because impingement is occurring at a different location, but it could be because the scapula is not doing its job and they just feel pain at in the shoulder joint, even though that's not where the cause of that pain is coming from. So we improve that scapula stability. Awareness of joint centration. So here's where like rotator cuff training comes in. Now if we're trying to improve stability of the joint and our rotator cuff are dynamic stabilizers, we want to make sure that they're doing their job of holding that joint in place. So I often use when describing shoulder training and stability of the shoulder training, it's just like any type of stability training, like training the core, right? So you get somebody in a neutral core or neutral lumbar spine, and then you challenge that position, right? So I might get somebody set so they have a nice neutral spine, and then I put them in a plank. So when they're in a plank, because their elbows and their feet are a distance apart, that core has to support their body to keep that position there. But gravity is pulling down. So they have to actually engage those stabilizer muscles in order to prevent extension from occurring, right? So we get them neutral, then we challenge it and hope that they have the strength and stability to keep that motion, right? So same thing with the shoulder. We want to make sure that they are in a good centralized posture and position first, and then we do different exercises to challenge the integrity of that joint and start to strengthen those muscles and those stabilizers there. Our next point, increasing glenohumeral mobility. This should be one of our first steps. If they lack mobility, we really want to do our best to improve that and really make it a priority, because the less mobility they have, the harder it is going to be to improve movement, to improve function. They won't be able to get into a good position, right? So this is where posture is going to be critical as well, always encouraging good posture with these movements and at rest as well. Because without good posture, or at least adequate posture, those movements are going to be impossible to do. And I always like giving people the example of, if you were, I'm assuming you're sitting down right now, just sit up nice and tall with your back away from the back of your chair. and then just sit up in a nice tall posture, like you're trying to touch the top of your head to the ceiling. And then I want you to lift your arm up as high as you can overhead. Now, if you have good mobility, you should be able to get that arm straight up, so we get about, 180 degrees of flexion there. Now what I want you to do is go into poor posture, right? So we're going to move that joint out of optimal alignment. So you're going to slouch forward around your shoulders, try and do that same movement, right? I don't have to even see what you're doing, and I know exactly what happened. You just lost all of that mobility, and now you're making it absolutely impossible for that joint to work properly. So if I have somebody that comes in that slouch posture and I just start doing traditional shoulder exercises, I am absolutely going to increase the dysfunction of that shoulder, and it's just a matter of time before I'm going to increase pain where they can't work out anymore and do those movements, right? So we have to increase mobility, we have to work on posture, all of those things to improve the movement of the shoulder joint. The other example I like to give is basically the same exact test. If you sit up nice and tall again and squeeze your shoulder blades together and push them apart, so you retract and protract your shoulders, you probably can feel that in all those muscles surrounding the scapula working as you do it. Now, if you slouch, exaggerate that kyphotic position and try and do the same thing, what happens to that movement, right? It disappears. You can't squeeze your shoulder blades together anymore, right? And it's something I want you to be aware of, because when somebody comes in with a slouch posture, we might think, you know what, we need to do some back exercises, we need to do some rows and pulls and things like that, which isn't necessarily the wrong thing all the time, but if they can't even retract their scapula because of that slouch position, they're going to be doing the wrong movements, and they're going to be compensating to create that movement and might actually be making things worse. So we have to be careful with some of these movements that we give our clients. All right, and then obviously we want to work on those muscle imbalances, right? So push versus pull. Most people just do way more pushing than pulling, so we want to try and match that as best we can. And in fact, probably doing more pulling than pushing exercises. And I mentioned the most common muscle imbalances, right? So upper trap to lower trap, managing those muscle imbalances, and then internal versus external rotation and constantly working on those as well. Avoid excessive overhead exercise. So we're not saying to never do overhead exercise, right? They might need that strength overhead. It's, again, just watch for excessive movement, training to fatigue. Again, like I said, knowing what they do in their everyday life, and are they playing a sport with lots of overhead movement? We don't want to make things worse there. And then obviously using good technique and really giving good coaching cues and setting them up in good positions, following a good progression, regression model, so I know what exercises they should be doing or shouldn't be doing with their program. All right, one of the most overlooked aspects of shoulder training, posture training, core training, really I can list a lot of different things here, it's poor respiratory function, right? They don't breathe properly. So what we see is people get away from diaphragmatic breathing, which is really how we should breathe, at least at rest, right? If you're out running or working out really hard, we're going to have other muscles help out because we need to get oxygen at a much quicker rate. But most people at rest, they start using secondary muscles, right, like their scalenes and their upper trap and their pecs to perform that breathing movement. And those muscles are now getting tighter and tighter because obviously we breathe a lot during the day. So they're constantly being used, and now their necks are getting tighter, their shoulders are getting tighter, their pecs are getting tighter, their posture is getting worse, their head's moving forward, their shoulders are starting to round, which all just links back into the things we were talking about and how now optimal shoulder movement is not going to be possible. And it is really amazing what, I know breathing isn't the hottest or the sexiest topic out there, but it's amazing what can happen with just simple breathing exercises, right? So, and play around with it yourself, especially if you have some mobility issues. Check your range of motion, right? Go through rotation, go through flexion extension of your shoulder, then do some relaxation and diaphragmatic breathing exercises and see if it gets better, right? Because we're working on relaxing the neck, relaxing the shoulder, using the diaphragm to breathe. So there's a bunch of different drills you can do. A couple just real quick I'll try and describe as the best I can because we don't have pictures right here. But while you're sitting in your chair, if you just take your hands and put them on your sides just below your ribs, so your fingers come to the front towards your stomach, and then your thumbs come to the back towards your lower back. And sit up nice and tall again. And I want you to work on breathing in through your nose, taking a deep breath. And when you inhale, right, we should see that diaphragm start to expand. And again, a lot of times you'll hear belly breathing for diaphragmatic breathing, which is true, but don't just think about the belly, right? It's a dome-shaped muscle, 360 degrees around. We want it expanding all around the abdominals, not just in the front. So with your hands in that position and you take that deep breath in, I want you to, one, feel your belly going into your fingers. I want you to feel your back actually going into your thumbs. And then I want you to feel your sides pushing into the palm of your hands, right? So you just take a few deep breaths where you inhale through your nose, and then you're going to exhale through, you can either exhale through your nose again or exhale through your mouth, and then back and forth, and practice deep breaths. Get all that air in, hold it for a few seconds, and then get all of that air out, right? And when you get that last bit of air out, you start feeling those abdominals start to contract, right? And it's like a little mini core workout as we do this, right? We're just trying to wake up some of those deep stabilizer muscles, but more in terms of the shoulder, we're getting the neck to relax, we're getting the shoulders to relax, we're getting those muscles that were doing all the breathing before to relax so we can get the shoulder in better alignment, right? So if we get a little bit of improvement there by getting those muscles to relax, you're going to see a little bit of improvement in shoulder range of motion, right? And we didn't even stretch, right? Not saying that stretching won't help as well, but all we did was start to get them in a better optimal position of that shoulder joint, and now they can move it a little bit better, all right? So that's one breathing exercise you can do. Another one I really like, you're going to lay on the floor, and you're going to have a bench or a chair that you rest your feet on. So your hips are going to be at 90 degrees, your knees are going to be at 90 degrees. So if you're sitting at a chair, again, you know, you can try this while you listen. Just lay on the floor, put your heels on that chair or bench, relax your head, relax your neck. All right, we kind of want to feel like we're melting into the floor as we breathe. Now, a couple things that we can do just to try and get better alignment, not just of the shoulder, but of the lumbar spine as well. You're going to posteriorly tilt your pelvis, and you can do this a couple ways, right? Think about pushing your lower back into the floor, right? Many people are kind of stuck in that extended posture, so we're just going to help them get out of it and then practice breathing, right? So we push that lower back towards the floor, dig your heels into the bench. That's going to turn on those hamstrings and help you posteriorly tilt as well, right? So you constantly have that tension there. The bottom portion of your hips will probably come off the ground just a tad, or maybe just about come off the ground, right? And then I want you to lay there with your palms up towards the ceiling. That's going to get our shoulders into an externally rotated position. And then again, you're just going to take a deep breath in through your nose, feel everything expand. That belly should go up and out to the sides and into the floor. And then we exhale completely. And again, get all of that breath out and really squeeze that stomach. And you feel those deep ab muscles starting to work as you do a few breaths here, right? So this does a ton of good. It helps relax you. It increases your parasympathetic nervous system activity. It's going to improve our posture, restore proper breathing patterns. So much more than just help with the shoulder, but it is an important thing. So try it. And if you have a client that comes in that's super amped up, they had a terrible day, the traffic was awful, they hit every traffic light, got in a fight with a spouse or at work or whatever it might be, they're jacked up. Their shoulders are probably in their ears, right? Their neck completely disappeared, and they're breathing from their chest, and they're just way too amped up to start lifting weights and loading that shoulder joint. So take literally 1 minute, 2 minutes, and just have them calm down a little bit, do a few cycles of breathing, and then go about your normal warm-up and just kind of calm them down, and then you can amp them back up again and, you know, and get them ready for whatever type of workout that you might have. All right, so kind of along the same lines, right, we have to assess posture, right? We need to, that should be one of the first things we look at. So if we look at the picture here all the way on the left, that would be that normal curvature of the spine, right? So we do have that lordotic curve of the lumbar spine, and then the kyphotic curve of the thoracic spine. So we have that S-shaped curve there, but not exaggerated. But in our other pictures, we start seeing some of the common abnormalities in posture, right? So that picture all the way to the left, that increased lordosis or anterior pelvic tilt, right? We see that increased lumbar spine curve there, the hips being pulled back in the back and then down in the front. In that second picture, we have that increased kyphosis. So that was kind of that posture we were talking about before, where you just can't move your shoulders, move your arms properly when you're in this position. So you're going to compensate a lot of different ways, and you start to see that forward head posture. And they'll probably do that when they lift their arms overhead as a compensation, right? So you see them shrug and you see them drive their head forward in order to lift their arms overhead, or they increase that lordotic curve, right? And they increase the extension in their lumbar spine to get their arms overhead, right? Or they might have a flat back, right? So that's like a straight spine, right? We want curvature of the spine. There's a reason that it has that S shape, but here they're going into a decreased lumbar curve, right, or that posterior pelvic tilt, and they're actually losing some of that kyphotic curve in the thoracic spine, right? So we want both there. With the thoracic spine, the scapula needs to rest on the thoracic spine area, and it is not perfectly flat, our scapula, right? It's going to have a rounded shape. So we actually need flexion of the spine in order for that scapula to rest properly on the back. So if they actually have a flat back, we're going to have problems there, and their scapula is not going to be able to glide appropriately across the thoracic spine there. So just the main point is take a picture, just look at it, write notes down, but make sure you're evaluating your client's posture, because if they don't have optimal posture, I know they're going to have limited movements of the scapula. Now, that being said, I'm also realistic, and I might have a 70-year-old client come in that has poor posture, and they've had it for the last 30 years. Now, I'm not going to be able to correct that, right? What I'm hoping for is, one, I'm going to make sure it doesn't get any worse, or I'm going to see a little bit of improvement. And a little bit of improvement is awesome, right? So if we go back to that exercise we did before, right, where you slouch and you try and lift your arms up over your head and you can't really do it, what if you just sit back a little bit, right? What if we just got you a few degrees of extension back in your thoracic spine? So just sit up a little bit, but still kind of a bad posture. See how much more your arms go up, right? It's amazing, just a few degrees of extension, and you get a lot more range of motion up the shoulder, right? So I'm just trying to get as much as I can. I'm not looking for perfection, because nobody's going to have perfect posture. I just want to get them as close to perfect posture as possible, and at least being aware of where their abnormalities are, right? Is it forward head posture? Is it a pelvic tilt? Is it a flat back? Whatever it might be. So we assess so we know the appropriate actions to take. All right. So with shoulder dysfunction, we've already talked about this a little bit, but we need to dig in deeper. The thoracic spine is just one of the most neglected joints of the body in terms of shoulder function, right? And if that thoracic spine can't move properly, the rest of the joint isn't going to work properly either, right? So we should see flexion, extension, and rotation all occurring at the thoracic spine. So make sure they can do that, right? This might be an everyday or every workout warm-up exercise, mobility exercise, or it might just be a test that you do to see, can you do it? If you can, okay, let's just make sure you never lose it. So we're going to start with flexion, and this might sound backwards, like, well, I don't want to flex. People are stuck in that flexion. Well, first, not everybody is. Some people, like we said, might actually have a decreased flexion or decreased kyphotic curve of their thoracic spine. So I actually want to do exercises that improve that flexion of the thoracic spine. So there's a couple different drills you can do. the first one, just real simple, kind of a test that you should give everybody is get them quadruped like we see in this picture here and do like a cat-cow exercise or cat-camel, whatever you want to call it. And what I want to see is each part of the vertebrae, they should have control over it. So if they're going to start in, let's say they're going to start in a flexed posture like this, I want them to completely flex their entire spine, including their head. So their head's going to drop down, they're going to push their hands into the floor so they can flex the thoracic spine all the way down into the lumbar spine. They can even do like a posterior pelvic tilt. So I want to see that rounded spine, right? And now I'm not loading this, right? I just want to see that they can do it, right? And then I want them to go into extension. So they're going to try and do it like one vertebrae at a time, essentially. So they're going to start with their head and lift their head up. So we start with the cervical spine. And then we're going to see if they can extend through the thoracic spine and then finally into the lumbar spine as they go into that cow position. And what you're going to see is people can't do it, right? They can't go through flexion extension like that. They're going to have movement occur one area, right? For some people it might be all in their head or in their neck. For some people it might be all in their lumbar spine. And you just see flexion extension occur at the lumbar spine only, and they can't control flexion anywhere else. So it's really interesting test to have people do or to test yourself. So if we're going to focus on flexion, some things that you can start with. So again, get on all fours so they're just like in a tabletop position. And one of the best cues I've heard was you'll take your hand and put it right below their chest. And then you're going to start to move your fingers towards their chest, and you're going to say, don't let me touch your chest, right? And as you do it and as you bring your hands closer to their chest, they're going to start to flex their thoracic spine. All right, so a real great way to cue that, and then we actually see them go into flexion, right? The main thing is I want to see, can you flex your thoracic spine? Some people are not going to be able to do it, so that's a good practice is just think about that. And then you can, you don't need your hand there. That's just to get them moving, and then they go through flexion and extension there. As they do it, when they go up into flexion, I do want to make sure that they're focusing on the right areas, right? So some of the scapula stabilizers should be turning on. They should be protracting their shoulders a little bit. Serratus anterior should be active. What I don't want active is their pecs, like pec minor. So if you can, and it'll obviously depend on your client if they're going to be comfortable with you touching them, but if you actually grab their pec and the very top portion kind of near their armpit, right where it inserts into the shoulder there, when you grab it, it should be relaxed. Some people it's going to be super tight, right? So I know they're using the wrong muscles to create this movement, or that pec is just so dominant, serratus anterior is not doing what it should do. All right, so you just have them practice, go into flexion, but keep that pec relaxed. It should be nice and soft as they go up. All right, so obviously just ask your clients if they're okay with you touching. For a female client, you might not be able to do that, but at least make them aware of it. They might be able to touch it with their opposite arm to see if it is staying relaxed or not. All right, and then they can just go through flexion, incorporate breathing still, right? I don't want them holding their breath as they do this exercise, but they just go through flexion extension, right? And then I can do it in different postures. They can go half kneeling or standing or squatting, right? And just I want to see a flexion extension occur in those positions there. All right, so we talked about flexion, so we don't want to forget about extension as well, right? So the main thing is we're going to make sure that that joint's moving properly, right? They can flex, they can extend. So here's a great exercise we can do. So if they are stuck in that flexion and they can't extend, we have them roll on the foam roller. So I would start with just some rolling of the thoracic spine. So basically they're just going to roll from the bottom of their scapula to the top of their scapula. Pretty much like you see in the picture here. And we can do it different ways. So like you see with the elbows straight out, they're going to do maybe 10 rolls back and forth, try and soften up that tissue there, and then have them bring their elbows in towards each other. That's actually going to spread the scapula apart a little bit, and they're going to be able to dig deeper into those muscles there, right? So they're just going to roll back and forth. Once we got a little bit of movement in there, now we're going to go through extension. So they can go to different areas of the spine, but probably start somewhere near the bottom of the scapula. And we're only going to stay in the thoracic spine here. So start at the bottom of the scapula. The hips are going to be on the ground, elbows out to the side, and then we're going to work on improving extension. So you're going to drive your head into your hands and extend over the roller, and then you're going to come back up. So it almost looks like a crunch, but you want to be careful on how you cue this because I don't want them just to arch their back. These are the people that when they were in cat-cow had a really hard time moving their thoracic spine, right? They just wanted to move their lumbar spine. So as they go back, what you would see is their rib cage is going to pop out, and they're going to increase the curve of their lumbar spine, right? And I don't want that to happen. I want to make sure the abdominals stay tight, and then they extend so the rib cage stays down. So again, you might want to incorporate breathing. Have them exhale before they extend back. When you exhale, it's just going to engage those abdominals and prevent the rib cage from flaring out, and then they just drive the back of the head to the floor, and then they come back up. All right, so we do 10 to 15 repetitions there. They can move the foam roller around and try a different spot as well, so you can play around with that. Another variation I like to do since they're in this position is actually going into lateral flexion. So they do the same exact thing, but instead of going back and forth on the roller through flexion extension, they're going to bend side to side. So again, we're only moving the thoracic spine, but they bring their elbow to one hip and then elbow to the other hip, and then just rotate back and forth like that. A great variation is using a peanut. So that would be, they have actual products out there that you can purchase, or you can take like 2 tennis balls or 2 lacrosse balls and just tape them together so they kind of make a peanut. So the balls will go on the tissue surrounding the spine, but there's a gap between, so there's actually no pressure on the spine, which is nice. And the great thing about this is you can get much more segmented and actually localize it on different vertebrae. Where the foam roller is pretty big and you're just getting a broad area, the peanut's going to dig in there a lot deeper and actually segment each vertebrae. So you might be tight in a particular area, so the tennis balls are just going to dig in there a little bit more. We also want to make sure there's no pictures in here, but I just did want to mention, don't forget about rotation as well. Like a side-lying rotation might be a good exercise to throw in there, where you're going to just lay on your side, your hands are stretched out, so one's on top of the other. You're going to put your top knee up at about a 90-degree bend. It could rest on like a foam roller, and then you're going to essentially roll over without letting your knee come off that roller, and then roll back up. Right, so or any type of thoracic rotation exercise. Sometimes these extension drills are too much for people to handle, and we can do rotation, and we still get some extension with those rotation exercises as well. So if you ever have a client that has pain or problems doing extension, just try and do rotation exercises. And we have a couple that are coming up here as well. So once we improve this mobility, then we're going to follow it up with some T-spine exercises to make sure we maximize that movement there. All right, so we might do something like this, like a bench T-spine mobility. All right, so you're going to kneel facing a bench with your elbows on the bench, and you're going to hold onto a stick. So it could be a dowel rod, or like you see here, this is a bar attachment for a cable machine. It almost looks like you're doing a bicep curl. So you're going to start with those elbows resting on the bench, knees on a pad, just to make it more comfortable. And then you're going to drop your hips back and extend your chest or your thoracic spine so your chest is reaching for the floor. And as you do it, you're going to bring that stick behind your head. You're going to get a nice little tricep stretch there, and you get great mobility occurring at the thoracic spine. So you would just go through flexion, extension in that movement. So this is a great follow-up to that first exercise, because this is still a mobility exercise, but you're actually going to engage some of those muscles between the scapula to help with that extension, right? So first they got a little bit more movement, and now we're going to strengthen some of that movement, and hopefully some new movement that we haven't had before. All right, so here, like I talked about before, just don't forget some extension exercises. I love these ones. So the first exercise I described is more of a stretch to help. You're going to actually use gravity to kind of help improve thoracic rotation and extension. Okay, so we're trying to use these muscles to improve extension and rotation once that mobility has been improved. So all we're going to do is start on all fours here. You're going to bring one hand behind your head. I really encourage optimal breathing in this exercise as well. So what you'll do is, as the elbow is pointing towards the floor, like we see in that picture on the left, you're going to take a deep breath in, then you're going to exhale as you rotate up. All right, and you're going to reach that elbow to the ceiling. So you're going to extend and rotate the thoracic spine and try and look, right? You're going to turn your head, look at your elbow as you reach and see if you can see the ceiling, and then you're going to inhale, go back down, and repeat. A couple of variations. Sometimes people start to rotate too much from the hips or the lumbar spine. So a simple way to correct this is actually just sit back if they can onto their heels. So almost like you're in a child pose. And then same thing, you're going to go through that rotation, but when those hips are flexed more than 90 degrees like that, you're going to be able to rotate solely from the thoracic spine and really lock that lumbar spine into place. And then the other variation that I always love to throw in, this one, you're training thoracic rotation with your shoulder, your glenohumeral joint, in an externally rotated position. So why not do it internally rotated as well? Some people have an issue with internal rotation, not just external rotation. So here, kind of like that exercise where you're trying to scratch your back, you're just going to reach behind your back and so you put your right hand, like we see in this picture here, put it on your lower back or towards your opposite hip with your palm facing up towards the ceiling, and you do the same exact movement, but now your shoulder's in an internally rotated position as you do it. All right, so again, we just kind of get multiple benefit from this exercise like that. Okay, so I know I've talked a ton about the scapula, but we're going to talk a little bit more specific strategies now. All right, so we've talked about the thoracic spine, the importance of getting flexion, extension, and rotation occurring. Now that we've got that in a better position, now we want to make sure that the scapula is doing the right thing, and oftentimes it can't because of muscle imbalances that occur there. Right, and here is just a list of some of the more common problems that we see. So we're going to see pec minor, posterior capsule, or the back side of the shoulder, and then subscapulus are all going to be tight. They're going to be shortened, and they're not allowing proper movement. So we want to do something to help stretch or lengthen those muscles there. And then because those are staying so tight, we often have opposing muscles that are going to be weakened and need help activating so that they can do their job in stability. So things like the rhomboids, the serratus anterior, the lower and the middle traps are all going to fall into that category. So just simple, we stretch we maybe foam roll, stretch the top three, and then we work on activation and strengthening drills of the bottom three, or just to simplify it there. All right, so SMFR is going to be our self-myofascial release. So it's just important. Most people need it. So if you aren't doing some type of foam rolling or lacrosse ball or tennis ball or something like that, whatever tool it might be, you're incorporating some type of soft tissue work for that client. It's just going to help movement. They're going to feel better once they get it down. Yes, I know it's painful and uncomfortable, but once they do it, they're just going to have the opportunity to move better. Right, so it's amazing with just a little bit of rolling on a foam roller, the opportunity to create more mobility that it will create. It won't last forever, unfortunately, but the more we do it, the more it's going to stay in that position. So just make sure you're incorporating some type of soft tissue work, especially for the three areas that we mentioned on the previous slide. So like the lats and the triceps. So most likely you're familiar with some foam rolling technique for those areas, so we don't have pictures included, but make sure you're rolling on a foam roller, digging in the lats, right, basically right where near that armpit, that's going to be the tender spot for most people, right? So we spend a minute or two per side rolling that area to help break up the tissue, move some water around, activate some nerve receptors to just create a better chance to stretch that muscle. So we'll do the lats, and then we might do the tricep. Right? There's different strategies to do the tricep. One I personally like is I'll just take a foam roller, put it on a bench, and I'll be on all fours
and then I'll just roll from the elbow towards the armpit and just get the length of that tricep, right? And you can go through flexion and extension of the elbow as you're rolling on it to create more movement in there. All right, so we foam roll it, we create this opportunity for it to stretch even better, and then really just go through whatever lat and tricep stretch that you prefer. Here are just a couple of them. So we see that picture on the lat, so we're in a half kneeling position. So if we're going to stretch the right lat, we're going to go on the right knee, the left hand is going to reach towards the floor, and then we just have a band that's just going to help assist us in the stretch. So we tie it off to a higher anchor point, wrap it around the wrist, and we just let it pull that lat and lengthen it, right? We can do kind of some PNF, contract, relax, where we engage the lats and then we let it relax. And each time we relax, we let it stretch a little bit more there. Another personal favorite of mine for the lat, it's essentially the same posture that you see here, but I would stand up. So I'd be in a split stance versus a half kneeling stance. And then I would take that back leg, so in this case, their right leg, and they would step behind them, almost like they were doing a curtsy, right? So now we're going to get into that. If we're looking at like fascial lines, that lateral line or side body, and we can create even more of a stretch as we do that. And then they can just start to move around a little bit and find where that stretch feels the best for them. All right, and then you can pretty much hang on to that same band. You might want to lower the attachment where it's tied off, but then we're just going to spin around, and then we can go right into a tricep stretch. So we're just going to turn around and then let the band pull our hand down towards our back. One warning, some people going into extension like this might not be comfortable. So if they do have pain in their shoulder, we would do some other kind of stretch if we really need to do the triceps. Or maybe we just foam roll and we don't stretch because it's causing issues at the shoulder when we do this movement. So just be aware of that any stretching and extension like that might actually be causing pain. So just watch how much extension they go into. So don't let that elbow go straight up to the ceiling. Right? And then we would just hold our stretches, contract, relax, whatever method that you want to incorporate there. The posterior capsule is going to be a big one, especially if you have a client that does not have good internal rotation. So if you were to measure their rotation of the shoulder, right, so they should be able to get about 90 degrees of external rotation, and they should be somewhere around 70 degrees of internal rotation. If they can't do that 70 degrees without letting their shoulder pull forward, then I'm going to take a guess that their posterior joint capsule is going to be tight, so the back side of that shoulder. So there's a few different stretches that we can do. Again, start with some foam rolling, and we can foam roll or do some type of myofascial release and stretch at the same time. All right, so what you can do, like you see in the picture here, I can take a lacrosse ball or a softball or something dense but smaller than a foam roller, and then I can dig into the back side of the shoulder. Right, so kind of where the rotator cuff are on the back side. And then just dig around there, right, kind of on the top portion of the armpit up to the shoulder. But everybody feels a little bit differently, so play around with it and see where the most tenderness is, and then they work on that area. Sometimes I'll just grab a tennis ball and I do it on the floor, and then I just lay on my side and dig that ball. So basically like you see here in this picture, but just imagine tilting it 90 degrees counterclockwise, you'd just be laying on the floor doing it. And now you can just kind of relax on that ball and just let those muscles relax and let go a little bit. And then we want to stretch it. So you can stretch and foam roll it, or you can just stretch it on your own or afterwards if it's too much coordination or too much to think about. So if we just talk about the stretch, don't worry about the ball there yet. Most people have seen that stretch where you grab your arm and then you pull it across your chest, trying to stretch out your shoulder. Most people do it wrong when they do it. So if we're trying to get the posterior joint capsule, we want to make sure that we keep that scapula back. We keep the shoulders in a retracted position, right? Because if I just pull my elbow across my chest as hard as I can, and do it right now, assuming it doesn't hurt you, pull it across and pay attention to where you feel that stretch. But also pay attention, what's your shoulder doing right now? You're completely rounding it forward, most likely. So you're actually stretching somebody into a position we're trying to get them out of. So be careful. We want to make sure we're getting them in a good position. So to fix that, retract the shoulder and then pull that elbow across without letting the shoulder go forward. One, see how that shoulder is staying back and you're staying in good posture. And then two, you're going to notice you feel that shoulder a little bit differently. You feel it a little bit deeper in the posterior side of that shoulder. I'm also a big fan of the genie stretch, which is essentially the same thing, but if I want a little bit more internal rotation, I'd put one arm over the other, kind of like picture a genie granting a wish. So let's just say if you want to do it with, as I describe it, your left arm is going to be on top of your right arm. So your left hand is going to be grabbing your right elbow. And then your left elbow will be on top of your right hand. So now you're going to retract, so you pull those shoulders back, then you're going to pull the elbow across the chest without letting the shoulder come forward, just like we did before. But now if you want to add a little bit more of an internal rotation stretch, take your left elbow and push it down into your hand, right? And now we're actually getting a little bit more internal rotation. You're going to feel that stretch a lot more, right? So a great way to improve that posterior capsule movement and mobility in there. All right, and then we mentioned the subscap, so one of our rotator cuff muscles. So this is our an internal rotator. A lot of times people get stuck in internal rotation and the subscap is really tight and stuck there. So if you look at somebody's posture and you watch them from the front when they're standing looking straight at you with their arms at their side, and you notice that their knuckles are pointing straight forward, I know they're in an internally rotated posture. So I want to work on improving external rotation. So yes, you can work on strengthening the external rotators, but if your internal rotators are so tight, they're not going to allow for that movement to occur. So first, we need to loosen up subscap in order to improve external rotation. So this one gets a little bit tricky. So we see a potential stretch you might be able to do here. This is actually a myofascial release technique. So you're going to take a dowel rod or some kind of stick, preferably if it had a soft ending. So you can take like a dowel rod and cut a hole in a tennis ball and then stick the tennis ball right on the end of the stick. That might be a little bit more comfortable for people than the end of a dowel rod. But you're going to stick it in. Remember, the subscap is basically the back side or the underside of that scapula. So you're going to dig it into the back side of that armpit, right? So you can see on the picture of the left, we're in an internally rotated position. And then what you're going to do is drive your arm up and then go into external rotation. So that thumb is going to be pointing up. So now we have a little bit of a stretch and myofascial release at the same time. If this one is a little bit complicated, another one you can do is really if you just lay on a bigger ball, like a softball or a myofascial ball that can actually reach into the back of your armpit, you might be able to just lay down and then stick that ball right into your armpit. One thing that we'll do is it requires a little bit of setup, but you'll take 4 tennis balls and you would tape them all together into a pyramid. I don't know that I can draw this very well, but I would take, 3 tennis balls here. I'll just use a different color maybe. And then I would take that 4th one and put it right on top. So if you're looking on the side, you would see this little, I'm sorry, not a great drawer, but you would see this pyramid shape. And then you just stick that on the floor, and then you lay right on top of it, and that top ball actually digs right into your subscap. And then you can just literally just lay on it and help relax that muscle to improve your external rotation there. That one does get a little bit tricky. One warning though, if you are digging on this area, there are some nerves that you might pinch on. So if you're ever doing this movement and feel like tingling in your arm and your shoulder and your hand, stop it immediately, get off that spot, and move it because you're not pushing in the right area. So this is kind of one of those things you'll know when you're there, especially if you're tight, you're going to hit it and it's going to be uncomfortable, and then the more you do it, the better it's going to feel. Okay, so we did a few drills, stretches, myofascial release techniques to improve mobility. So first we improve mobility so we can move, strengthen, and stabilize better. So step 1, move better, and then we stabilize better. So now that the shoulder joint's hopefully moving a little bit better, now we want to work on some of those scapula stabilizing drills. So really these are going to be exercises that are starting to wake up some of those muscles that surround the scapula. Remember I said there's about 17 muscles that actually connect there. So lots of little muscles that we want working all together. So you might be familiar with like your Blackburn exercises, your YT, WLs. We're going to go over a few of those. Serratus anterior, I've mentioned that a few times, but that's a big one, especially when you have that scapular winging. It might not be the only reason, but a common culprit is serratus anterior is not stabilizing properly. So I want to do some drills to help engage that better. All right, so a Y drill is going to be great for strengthening the lower trap, right? Talking about impingement, we want to make sure that we are strengthening the lower trap. So we do our Y raises. So probably the simplest way to start it would be on all fours. Kind of like you see in the picture on the left, weights are not necessary unless they're at the point where they can actually use resistance. But you would go on all fours, and then you would lift that thumb up towards the ceiling in a Y position. So you'd be doing one arm at a time, but if both arms are up, you would look like a Y. The main thing is make sure you're at about 135-degree angle. So this angle right here is about 135 degrees. That's going to be in the direct line of pull of our lower trap to help us activate it better. Often what you're going to see people do, let me just change my color. All right, they're going to go into their T-raise, which is a different exercise, so we want to make sure we distinguish that. So their arm is too low, or they raise it up straight, and now they're probably using their upper trap to do the movement, not their lower trap, because they're more comfortable with that. Or we said in impingement, upper trap is having an easier time activating than lower trap. So make sure we have that 135-degree angle there when you set them up. So start on all fours, picture on the left, add your resistance if you need it. Here's another great one. You're actually getting two different exercises in one, but with the band. So I tie the band off to an anchor point, and then I would have a little bit of resistance. So I can do one arm high, one arm low, so we have kind of this X pattern, and we can go back and forth just to train different scapula stabilizers there. And again, they're half kneeling. You can change around the posture. It can be standing, all different ways we can do it. Okay, then our T exercises. So on a bench is a good place to start. And you can do that with the Y raise as well, but you just be face down, and then we would go into, it's basically like a reverse fly, but I want to make sure I'm focusing on the scapula, right, not just the posterior deltoid. I want to make sure those scapula are retracting and they feel it between their shoulder blades, not just in their shoulders. So if they have weight and all they feel are their shoulders, get rid of that weight and really make them focus on pinching those shoulder blades together, helping strengthening the rhomboids in the middle trap, and then obviously the posterior deltoid as well. External rotation is not necessary, but it doesn't hurt either. So if you feel like they need extra external rotation, just have them point their thumbs up as they do this movement, right? Or they can do a band pull apart like we see on the picture on the right. So just grab a band and then just pull it apart, right? So you can have a pronated grip like you see here, or if you want more external rotation, go into a supinated grip and squeeze those shoulder blades together. All right, the W and the L drills weren't listed in there. If you search online, you'll be able to see what those look like. But the W is basically the same thing. You can lay down on that bench again, prone, and then bend the elbows and then lift the arms up. So when you lift the arms, you look like a W now. And then your L raises are basically your external rotation, or like a scarecrow raise. So your elbows would be straight out to the side, and then you just externally rotate, internally rotate back and forth. So those are getting more rotator cuff muscles, but they do get a little bit of scapula stability as well. Other ways to work on improving scapular stability is focusing on that packed shoulder. All right, when we say packed, we don't mean immobile, right? Again, I mentioned that back and down posture. Some people will think that that is packed, and it could be, but remember, the scapula have to be able to move, but I want them flat on my back, right? So I don't want any winging. So the scapula is tight to the ribs, but it does have the ability to move if I need it to. So we'll go through a few examples. So start with a plank, but, you know, I know everybody listening, I'm sure, has done tons and tons of planks themselves and with their clients, but think about it a little bit differently. Don't think about it as a core stability exercise. Think about it as a shoulder stability exercise. And what I want you to do is, as you do that plank, think about pushing your elbows into the floor and protracting the scapula just slightly. Push them apart a little bit. Now, don't go into too much flexion of the thoracic spine. A little bit is going to be okay, but I'm mainly pushing those scapula apart to really get my scapula stabilizers active, right? We're going to get that shoulder into a better position, and then we're working on stability and endurance as we hold that. So they might notice, you know what, their stomach fatigues first, right? Maybe that's the weaker link. Or maybe, no, my stomach's fine and my shoulders are getting so super fatigued. Okay, then I know we need to work on it because we don't have great endurance in the shoulders. All right, some other great ones are wall slides. So we have two variations here. So one using gliders or valve slides, sliding up a wall. The other using the foam roller. I probably use that foam roller exercise more than any. So how it would look is you would set up like it should look like you're doing a plank against the wall. So you're going to take a foam roller, push it up against the wall. It's going to start around your wrists, and the foam roller should be about chest to shoulder height. Put 1 foot forward as you do this. All right, so your first step is we want to push that roller into the wall. And that's why I love using the roller, because you kind of have to. If you don't push, the roller is just going to fall to the ground. So you have to put pressure onto that roller. When you do that, they will automatically engage their serratus anterior. All right, so which most likely they need some work there. As they do it, they're going to roll that foam roller up the wall. So as their hands go up overhead, the roller is going to start rolling down towards their elbow. So they're pushing into the wall or the roller the whole time, holding it against the wall, and then they're going to roll it up. So the push into the wall is getting the serratus. As they roll it up, they're going into upward rotation of the scapula. Right? We talked about that a lot before, but as the arms go overhead, I need those scapula to upwardly rotate. As they go into that upward rotation, we can even add an overhead shrug as well. So as the arms are overhead, then they shrug to engage the upper traps. Now, I know we talked about how the upper traps are dominant and compared to the lower traps, but this is just a good drill to practice because most people don't shrug with their arms overhead, and the upper traps should help rotate the scapula this way. So they're going to feel it completely different in their traps versus the traditional way to do shrugs, right, where you grab dumbbells or something and you just do your shrugging exercise that way. Get the scapula into upward rotation and then do your shrug. It's going to be a completely different exercise. And we're not doing it for strength. We're not going to load it up with much resistance. In fact, just your arms is going to be plenty for most people, and they add that shrug there. Right, so many great things occurring with this exercise. And one final thing that they're going to notice is actually they get a little stretch in the thoracic spine. So as those arms go up, they're going to get a little bit of thoracic extension too, which is probably a good thing as well. Just make sure as they extend, they don't extend through the lumbar spine and they engage that stomach. Again, maybe they exhale as they roll that foam roller up to help keep the abdominals contracted. All right, and then you can do the same thing with the valve slides as well. Slide up the wall, and in all honesty, you actually don't need anything. You can just slide your elbows up the wall. Another great variation that I like to do is just put your elbows up against the wall. Again, like you're doing a plank, you're going to slide up kind of in that Y position. When you get completely overhead or as straight as they can get, you're going to try and lift your arms off the wall without moving your body. Right? It becomes really difficult. Some people won't even be able to get their arms off the wall, but we're just getting those scapula stabilizers really to engage as they do that movement. Right? Again, so slide the arms up, probably exhale when they do it. As you slide up, your nose is going to come to the wall, your chest is going to come to the wall, and then you try and lift your arms off. Right, so great stability exercise there. More stability exercises, so now a little more to engage serratus anterior. So we're going to do that protraction push-up or scap push-up, has a few different names. studies are showing that if you can do this with your feet elevated, like you see in this picture here, it actually can help engage the serratus anterior even more. That might be too tough for some people, so if they need to, start on the floor, even start against the wall, whatever level that they're on, hands on a bench, because we want to make sure they do this right and we don't sacrifice form just to do that movement. And all they're going to do is try and push their hands into the floor as hard as they can and go into that protraction. So you're going to feel that scapula slide along the rib cage away from each other. And then they lower down, they slide back together, and then they push back up, right? And you can, like you see here, you can even add some resistance. So that's a band wrapped around his back, and then he's adding resistance as he pushes up and pushes those scapula away. One thing you do want to try and get is that shoulder angle. It's about 100 to 110 degrees if possible. So this angle, sorry, blue is not very good. Okay, this angle right here, all right, so it's about 90 degrees, just trying to get a little bit further so we see a little bit better in this picture here. So I just want those elbows kind of out in front of them just a little bit. Again, that's going to help engage that serrator and those scapula stabilizers back here a little bit better. Usually with the feet elevated, that puts you into a good position. But the other thing you can do real simply is as you do push-ups, make sure they finish a push-up. You complete a push-up by this position here. So when they're at the top of the push-up, you're not done when your elbows are straight. You're done when your scapula are pushed apart, right? So just remind them, finish the push-up. Don't just do half of it. All right, and kind of similar, as you're working on rows, work on retraction. And this is going to be really difficult for some people. So just going from picture 1 to picture 2, just retracting the scapula without flexing the elbow is going to be incredibly hard, right? So in the first picture, allow the weight to pull them into protraction, right? So they should feel that scapula sliding across their back a little bit. They'll feel a little stretch between the scapula. Some of those stabilizers are being lengthened. Then they're going to tighten where they feel that stretch. So without bending the elbow, they retract the shoulder, and then they go into the row. Now, they should be able to do this in one fluid motion, but break it down at first. Make it a little bit simpler so they can learn it piece by piece, and then you can put it together. All right, so we retract, and then we row. Whether it's a cable row, a dumbbell row, again, just involve the scapula in these movements. Don't let them fix it, right? It's that packed shoulder. It's moving. It's tight, but it's moving, right? It's flat against the back. All right, and then use the plane of scaption whenever possible. So that's the picture that we see here. It's not, if you're going to do like a scaption raise, it's not going to be a front raise. It's not going to be a lateral raise. It's going to be kind of right in the middle there, 30 to 45 degrees of anterior to the frontal plane, right? So it's kind of right in between the front raise and the lateral raise. You can do it with external rotation with the thumb up here, or you can do a neutral grip as well. Just don't do it in internal rotation or your empty cup raise. We don't want to go into internal rotation and then raise the arm. That's going to be a high-risk position. So thumb up, or at least staying away from that internally rotated position. You can start in internally rotated and then move into external rotation. Just don't internally rotate and lift at the same time. So again, make this movement about the scapula. So it's not just the deltoids working here, right? Keep the weight light. Most people want to do heavy weight and just work their deltoids. Again, this is a stability exercise. I want the scapula moving. So as you lift your arms up in the scaption plane, it's a little easier for them to feel the scapula sliding into upward rotation and then downward rotation. So they almost want to feel it more in the back side of the shoulder versus the top of the shoulder as they do this movement, right? And we're going to see it in other exercises as well. So when you do an overhead press, stay in this plane of motion. Don't have the elbows out to the side like you're doing a traditional barbell press. Use dumbbells or kettlebells and keep it more in the plane of scaption. It's going to just be much better at improving that function of the shoulder as you do overhead movement. All right. I know I spent a ton of time on impingement, but it is such an important thing that we work on these exercises to reduce the chances of impingement. But really, impingement and rotator cuff tears and strains are essentially the same the same thing. You will see an impingement in 100% of rotator cuff tears because it's the impingement that's resulting in the tear, unless there was some type of trauma or accident or fall or blow or something like that. There's obviously exceptions, but for the most part, people that have an impingement, it's just the next step is going to be a strain or a tear. So we just want to make sure that we are training the rotator cuff as stabilizers, and we're going to get to this in a little bit. But here we have our internal, external rotators. Remember, their role is to stabilize, not just to move. So we're going to show a couple of external rotation drills that you're probably familiar with. But the main thing I want you to get from this is don't only train the rotator cuff with strength exercises. Train it with stability exercises because that's what it's supposed to do, right? So we want to try, just like core training, like I mentioned before, we want to get this joint in a good position and then we challenge it. So that's what we'll do to improve stability of the rotator cuff. Because remember, the main role of these muscles are to hold that joint in proper position, prevent it from being elevated into the acromion. So we need these muscles to activate, keep that joint centrated, and then allow for movement around that joint appropriately. Right? So we'll get into a few rotator cuff exercises. Our labrum tears, so most likely a labrum tear is going to be from some type of trauma, a fall, repetitive movement. Maybe they were an athlete like baseball players. You'll hear of common injury as a labrum tear just because of that constant overuse of overhead movement. Or it could be an exercise, a sudden pull, like lifting something or maybe hanging from a bar and we didn't keep that shoulder engaged and tight and stable. That might lead to a labrum tear as well. Some symptoms, they might feel pain with overhead activity, maybe some catching, popping, grinding, locking. There might be some instability there. They're going to experience loss of strength, decreased range of motion. Again, I'm not saying these so you can diagnose it and evaluate it, just kind of for your own information. And then there's different types of labrum tears. Actually, let me back up. The labrum, just in case you're not familiar with it, we have a nice picture of it here. So remember the glenoid or the glenoid cavity, that's the cavity on the side of the scapula that the head of the humerus sits in. Now, the head of the humerus is big compared to this indentation in the scapula, so the labrum actually provides extra deepening and extra cushioning for that to sit in. So that's what the labrum is. So you might hear something like a slap tear, superior labrum from anterior to posterior. This is most commonly seen in overhead throwing athletes. So again, like your baseball player, your volleyball player. You'll see the tear at the top of the socket, kind of where the bicep tendon attaches to the shoulder. A Bankart lesion, you might hear another type of labral tear. This typically occurs with dislocation. So as the shoulder dislocates from the joint, there's typically a tear here. And once you have that happen, you're more susceptible to tears or dislocations. The posterior labrum tear on the back side of the shoulder, this is the least common, but you may see it. It's often called internal impingement. Here we have the labrum and the posterior rotator cuff getting pinched together, essentially. So treatment, if somebody has a labrum tear, they might need surgery, they may not. There's much success with physical therapy. But again, if there's some type of tearing, this is now a medical issue that needs to be dealt with and not a fitness problem. So we're not going to have as much control over some of the other things that we might be able to do for that person. All right. I've already talked a little bit about the rotator cuff, but again, just remember the rotator cuff is designed for stabilizing that joint and fight against some of the forces that are being placed on the humeral head. Like I mentioned, the deltoids might be pulling and driving the humeral head up. The rotator cuff's role is to activate first and hold that back into position, actually pull the joint down as the arm moves overhead. So like we see that first point there, maintain the position of the humeral head against the glenoid. So that's what we want to do. So when we do our rotator cuff exercises, we want to make sure that we involve things that are training for stability, not just strength. Strength as well, but don't forget about that stability. All right. we need to make sure we have adequate strength, but also flexibility. So we've already talked a lot about flexibility, but make sure those muscles can move and that joint can move properly. So start with those mobility exercises, and then we'll get into our strengthening exercises. Typically, your external rotators are going to be the weakest. Don't ignore internal rotation. Oftentimes, a client lacks internal rotation, so they need to make sure they improve range of motion in internal rotation. And potentially external rotation as well. So just make sure you are testing these things to see where they need mobility, where they need strength, and things like that. All right, and the supraspinatus, that goes right along the top. That's typically where we see those tears occur. Just going to go back a little bit, like we see in this picture, running right across the top portion. We have our supraspinatus. Again, when that humeral head drives up, it pushes into the acromion. This gets pinched and pinched and pinched until eventually it'll rip and tear. So that's typically the most common thing we'll see there in terms of tears. Some statistics of failure rate for rotator cuff surgery, 25 to 90%. That's just a ridiculous range. So you just don't know. Sometimes surgery, so 90% success rate is great, 25% rate is awful, so every person is going to be different. So many people have great success even with full rotator cuff tears using PT and don't need surgery. I'm not telling you to tell a client that had a rotator cuff tear not to have surgery. If surgery is the best option for them, they might want to go that route for the fastest recovery. Other people may want to try physical therapy first. But one of those things, it takes time, it takes effort, it takes energy. If you're going to go the PT route, that many people don't have that kind of commitment to stick to. So make sure they know all of their options if they are going to have to go through a surgery or if they can go through PT. Like I mentioned before, when training the rotator cuff, there's some other things that we want to think of, right, besides just strength. We want to really consider proprioception, right? We want to train it in isolation. We want perturbation training where we're adding some instability and challenging that joint. Remember, just like core training, we get them in optimal alignment and then we challenge that alignment and see if they can maintain it. So that's a lot of the drills that you're going to see here is focusing on stability, not necessarily strength, although we'll include some of those as well. And even rate of force development, this is probably more relevant if you're working with an athlete, but working on eccentric training and plyometric training for the shoulder. That's going to be much more advanced, but there is some many successful exercises for improving rotator cuff strength with that type of movement. But we're going to focus on more on the proprioception and stability type training for the purposes of this workshop. Okay, so starting with your kind of isolation type exercises, your typical external rotation. This one, just according to EMG studies, has been shown to be the best activator for infraspinatus and teres minor, our external rotators of the shoulder. All right, so just lying on your shoulder, or I'm sorry, lying on your side, light resistance, or for some people, no resistance, keeping that elbow touching your side, and then going through external rotation, right? So just a great way to develop some baseline strength, to isolate that movement. Isometric holds are going to be great as well, right? Get them, because now we can control the shoulder. I want to get that glenohumeral joint and the scapula in good position, then we're going to try and challenge it. So they're going to hold a band and not let that band pull them into internal rotation, right? So they're not actually moving, they're just isometrically holding, right? Or change positions, change body positions. So standing, half kneeling, different angles, the arm raised, bent, whatever it might be. So play around and just get them in different external rotation holds, and then they just maintain that position for, start small, start 5 seconds. These muscles are probably weak. I don't want compensations to develop. So as they hold it, if you start to see that shoulder creep up, I know they're compensating and trying to use those upper traps. Remember, we talked about impingement. Upper traps want to take over. So don't let them. Keep that scapula stabilizing. Keep the rotator cuff stabilizing as they hold those positions there. Rhythmic stabilization is also going to be great. So they just lie on their back like you see right here. Reach the arm up, fully extend the arm, the elbow, But make sure, remember, the whole point is you get them in good neutral position first. So watch out. What they're going to want to do is reach that shoulder forward. I want them to push it, right? Put your hand under their shoulder. They should be pushing that into your hand, right? Push the head of the humerus into the floor. Now as they hold that position, you try and knock it over, right? So you're just going to add gentle pushes in all different planes of motion, trying to knock them out of alignment, and you just cue them, don't let me move you, right? They shouldn't try and guess where you're pushing. It's probably better to have them close their eyes so they don't know where you're coming from, and then they have to react to that stability, right? And that's going to be a great rotator cuff and overall shoulder stabilizing exercise. Another one I love to do since they're in this position already is a bottoms-up kettlebell hold. So you get in this position, then you grab a kettlebell, hold it by the handle so the ball of the kettlebell is actually up in the air, and then they just balance it, right? They don't even have to move. They just grip it tight and don't let the kettlebell flip over. That's a great start to a bottoms-up hold to improve stabilization of the rotator cuff. All right, and then we can add other variations as well here with a stability ball or a medicine ball, right? So they can go on all fours with a medicine ball under each arm or under each hand, and you're just going to gently push or tap with your foot the medicine ball so it moves, and they have to correct it and put it back into that neutral position. They just adjust for whatever way you're pushing, right? Or if their hands are on a stability ball and you lightly tap that stability ball, and they have to react and try and stabilize the whole time. Right, so other great rhythmic stabilization exercises. Perturbation training. So here there's kind of unexpected, it's very similar. So now you're going to add unexpected challenges to that hold, right? So the picture on the left holding a band in that external rotation position. So it's an isometric hold, keeping that shoulder in optimal alignment. And so he's doing it himself here where he's just kind of flicking the band and then having to hold it. Or you can, as the trainer, you can flick that band or move the band around, and they have to react and control that, right? Same with the ball against the wall. They have to push it into the wall, and then you push that ball around, right, and create those unexpected movements that they have to correct there. Right, but it's about reflexing. It's about reacting to that movement, and that's what's often the missing piece of rotator cuff training. It's usually just those strength exercises where they're grabbing a band and trying to go through external rotation, but the forces placed on the shoulder are so much more than a small tubing would allow, and we want to get more into these closed chain type exercises that enhance stability, not just strength. So again, you don't have to eliminate those exercises. Just make sure when you do those isolation strength exercises, we're doing some type of stability training for the rotator cuff as well. All right, other great ones, so a body blade like we see on the right, so you're probably familiar with this. Again, it's just causing that movement, and as the blade vibrates, you just hold on and try and stabilize. Very similar to if you don't have a body blade, that band picture, it's almost the same exercise. So the picture on the right with the band, you flick that band, and as it moves and vibrates, they just have to stabilize it. So if you don't have a body blade, this is a great way to implement that as well. All right, and then shoulder taps as well, just working on stability. So you have somebody, and again, the exercises that you can incorporate multiple types of stability are great. So we're going to get into that high plank or push-up position with the feet wide. So we have great core stability work here. As you lift one arm up, your body wants to rotate. That core has to engage to prevent it, right? And all you're going to do is take one arm, try and touch the opposite shoulder, right? So the stability is in that left arm, like we see in the picture here. So that left hand is pushing into the floor. They're probably slightly protracted. Scapula is packed, right? So the serratus anterior is engaged, keeping that scapula flat on the back, and then they hold that position there, and then they're going to alternate to the other side. All right, so we're just going to hold it for like a second, and I just want to see them stabilize before they switch to the other side. One other stability exercise, it's not in here, but I'm a big fan. I mentioned that kettlebell bottoms up hold. I love the walking kettlebell holds as well, bottoms up hold. So you take that kettlebell again, you hold it by the handles with the ball part up, and then they just hold it there trying to stabilize it. You grip that tight, rotator cuff has to hold, has to activate, stabilize, keep that joint in proper position, and then you can walk to add more of a challenge and try not to let the kettlebell fall over. So all great stability exercises for training that rotator cuff and the scapula as well. Okay, some programming tips. So when should we do this stability training? How much should we do it? So first, when? Really, there are so many different ways to apply everything that we've talked about in here. For some people, this is going to be their warm-up and their movement prep. We're just going to do, now I don't recommend doing all of these exercises because you're just going to kill their shoulder and then they won't be able to do anything in the workout. But you just pick the ones that seem to benefit them the most, pick a handful, and then do them as part of their warm-up, their movement preparation, right, their activation drills. So you should have a couple activation drills for the shoulder in every client's warm-up. So I just pick a couple that I do here, light rep, not to fatigue them, just to activate them, right, just to get them going, not super high reps, 5 to 10 reps or 10 to 20 seconds, just to get them feeling those muscles working properly and getting that joint into proper alignment, trying to get their posture moving a little bit better. So just making sure I do these rotator cuff stability exercises and these scapula stabilizing exercises before every workout, set them up for an even better workout. If you want to train more intense, do it after training, right? You can give them higher rep, higher fatiguing exercises afterwards. We're not training to complete fatigue, just more fatigue. So I just want to make sure I mention that we're not completely fatiguing these muscles because I want them to be able to activate and do things. I don't want to completely fatigue them so I hurt myself later in the day because I just can't lift my arms properly and I can't stabilize because I fatigued them so much, right? But I want to improve stability. I want to improve endurance. So my goal is to hold these positions longer for more reps because those are things that they're going to need to be able to do during my workout, during activities of daily living. So really apply it different ways. And it's okay to have them in the workout. Sometimes people will complain like, I can't do all of these different things in the workout, but really I need to. You may not want like a 30-minute warm-up and doing all these exercises because we're just talking about one joint. Don't forget about the spine and the knee and the hip, the ankle. We have to incorporate all of these things. But maybe when you can do some of these stabilizing exercises, if you couldn't get it all in during the warm-up, make it part of your workout, right? It's going to really challenge some people. So do it as a superset or a triset, right? Maybe I do a lower body exercise, I do my squats, and then I do my rows, and then I'm going to do a stability exercise, and then I'm going to do my T raises or my Y raises as my third exercise, and then I repeat. And then my next triset, I'm going to do lunges, I'm going to do push-ups, and then I'm going to do a bottoms-up kettlebell walk, right? So there's just so many different ways that you can implement these different drills in to your routines with your clients. So play around with it and see what seems to work best for you and your client. Okay, so for pretty much all of this workshop, I talked about tightness of the shoulder and not being able to move properly, but I don't want to forget that that is not everybody. Some people actually move too much and they have too much mobility. They're hypermobile, and that is not a good thing either, right? We want that optimal movement, right? Because the more I go to the more I leave optimal range of motion, the more pressure I put on that shoulder capsule and the different soft tissues and connective tissues of that joint, which might lead to tearing and dislocations and things like that. So when I have somebody, again, I should assess them. If I assess somebody and they can get further than 100 degrees of flexion, or they go into extension and they get like 60 degrees, like just incredible ranges of motion, and get over 90 degrees of external rotation, that's not a good thing because they most likely can't control that whole range of motion. And now if I give them weight, they're going to have a hard time staying in normal range of motion because they have the ability to get outside of those positions. So their role or their goal now is not mobility. They already have too much of it. I am focusing on stability and strength with this person so they understand here's normal range of motion, here's where you stay. So if you're going to do stretching with this type of person, and they're probably the type of people that like stretching because they're so good at it, or they're too good at it, if you're going to do stretching, you only allow them to go to that normal range of motion, and when they hit that end range where they should be stopping, do some PNF exercises, right? Make them contract, relax in those positions, not to get more range of motion, but to add strength to those end ranges of motion. So that might be a good, appropriate type of stretching, if you want to call it that, for this type of client. So their high-risk positions are going to be an external rotation with greater than 90 degrees of abduction or horizontal abduction. Oftentimes you'll hear like that high five position. So if you're going to give somebody a high five, again, they're getting close to end range, and if you load these positions, it might lead to a dislocation or some type of tearing on that joint. So just be careful in those high-risk positions. Try and keep them out of it. Same thing, upright rows might fall into that category with when they go into abduction and internal rotation like we talked about before. But some activities you probably want to avoid, push-up or presses with wide grip, just because we might be putting too much stress on that shoulder joint. Pec deck or flies, again, and not that these might be never do them, but they can do too much range of motion. So if they're on like a pec deck machine or doing a dumbbell fly, I mean, picture it, they can just stretch so far, their hands will touch the floor, they can just stretch that the bars behind them way too far, putting tons of pressure on the shoulder. So if you are going to do these exercises, do it from the floor instead of a bench so they can't go through too much range of motion. Or if they're on a machine, limit how far they can go back so the machine just stops and they can't get any further. Behind the neck pull downs or presses, that's that high five position, right? They're not going to have a good ability to stabilize. Really, most people don't want to do that exercise anyway. So stay away from that behind the neck position. I mentioned that shoulder extension stretches and shoulder abduction stretches. Again, this person has too much mobility to begin with, so they're going to be stretching too far into extension and too far into abduction, and they have too much mobility, and I don't want to create more of it. So we take them to normal range of motion, and we do our contract, relax, isometric holds to help improve that stability, not gain more mobility there. All right, and then just some other tips for programming or modifications. One, use dumbbells, stay away from barbells and machine presses especially, because when you're using a barbell or a machine, you're going to be fixed. You have to move both arms and both shoulders in that same range of motion that the bar or the machine is going in, and your shoulders might not want to move that way. So dumbbells, you have much more freedom. If I'm going to do an overhead press with a dumbbell or a kettlebell, I can go through internal and external rotation as I press, where a barbell, I'm stuck in that one position and I have to press from there, right? So you have great variety with dumbbells versus barbells, and plus I can go one arm versus two arm. It's much easier to press one arm overhead versus two, especially those clients that are tight. If their lats are tight, when they lift both arms overhead, it's going to make it much harder, right? Try it from your seat right now. If you reach your arms overhead, both arms at the same time, or go through flexion, both arms at the same time, and then one arm at a time, you're going to see it was much easier to move that one arm versus two, right? So dumbbells and kettlebells or bands or something that I'm not fixed with both arms together. All right, we talked about overhead strengthening exercises. If you have an overhead athlete, your baseball players, volleyball players, manage it, right? Make sure you know when they're practicing, what they're doing in practice, how much overhead exercise are you going to add on to what they're already doing. And then absolutely include scapular stability in your warm-ups before all exercises. Again, you don't have to do all the ones we said there, but just a couple. It won't take you any more than a few minutes to do a set of some Y raises, some T raises, some serratus, some scap pushes, and things like that. There's a ton of exercises. We just touched on a few of them today, but include some type of stability, and not just the scapula, the rotator cuff as well. All right, well, I hope you got a lot out of this workshop. Just to recap a few things, we need that combination of mobility and stability, right? So make sure you have great mobility of the glenohumeral joint, right? Usually flexion is a problem for people, usually internal and external rotation is a problem. So check it on your client, check it on yourself, and then do these different strategies to improve that mobility. And then Step 2 is, and I'm sorry, and I forgot the thoracic, right? And don't forget about thoracic mobility as well, flexion, extension, and rotation. So we have those 2 joints we're trying to improve mobility, but then we also want to improve stability at the same time. So we improve mobility, and then we improve rotator cuff stability, scapula stability, all right? So if you can do those 4 things, you're going to be doing so much good and great things for your clients and most likely for yourself as well. So improve mobility, improve stability with all of your programs. So that's it. Again, I hope you got a lot of things that you can apply right away with your clients and with yourself. And hopefully you took great notes and can go back and try out some of these exercises as soon as you're done listening to this. Again, just to get your completion certificate, make sure you go to our website, exerciseetc, click on administration, click on webinar on demand, and then fill in all the required fields, hit submit, and then you can print or save your documentation there. Thank you so much for joining us today. I hope you check out some of our live workshops and some of our other webinars that you can view whenever you want, and hopefully we see you again soon. All right, thank you.